As healthcare professionals, you have the opportunity to work with patients who are blind or visually impaired. Statistics tell us that the opportunity to work with individuals with significant vision loss will steadily increase in the future. The purpose of this video is to provide you with strategies for working effectively with patients with significant vision loss. Applying just a few communication skills will improve the experience for your patients and help you to provide even more effective medical care. Individuals who are blind or visually impaired travel or navigate their world in a variety of ways. Some choose to use a white cane to travel safely. Others prefer to travel with a guide dog. Some rely upon sighted assistance. And lastly, others do not show any obvious cues for visual impairment. Imagine entering a hospital or a doctor's office as a person with low vision. The situation on its own is anxiety-provoking, but even more so for a person with low vision. Individuals with vision loss are all unique as to what it is that they can see. Although their needs may vary, the best way to meet those needs is to simply ask, how can I best assist you? There are some specific strategies and communication skills that will help the person feel more comfortable and therefore improve the quality of the patient care. Here are some tips for how to do this. We will show examples of ineffective communication, followed by examples of effective communication and patient care. The first tip is to provide specific directions or assistance in getting the patients to where they need to be.
Hi, do you need help?
Oh, yes, thank you. I have an appointment with Dr. Jones.
Okay, his office is on the third floor to the left.
You probably noticed that no specific directions were provided to the elevator or how to get to the doctor's office. Now let's review the situation to show how you can be of better help.
Hi, my name is Alice. I'm the receptionist. May I help you?
Yes, I have an appointment with Dr. Jones.
Hey, Dr. Jones' office is on the third floor. Would you like assistance?
Would that be helpful?
I'll press the button for you.
Thank you.
Okay, so Dr. Jones' office is on the third floor, and you'll exit the elevator to your left, and then his office will be the first one on the right. It's about 20 feet from the elevator. Would you like assistance with the elevator?
No, I think you've been very helpful. I think I got it now.
Okay.
By offering sighted guide assistance and providing specific direction to the doctor's office, the receptionist was of great assistance to this patient. In the first tip we viewed, the receptionist offered and provided sighted guide. In places that are confusing or unfamiliar, it's very helpful to offer sighted guide assistance. Let's view an example of ineffective sighted guide.
Ms. Wilcox, the doctor is ready to see you now. Would you like assistance to the room?
Yes.
By reaching out and taking her wrist, you can easily startle the individual and cause her to lose balance.
Would you like assistance to the room?
Yes, please.
Let's view an example of effective sighted guide assistance.
Would you like to take my elbow and I will guide you?
Thank you.
The office is just straight down the hall here, about 20 feet ahead of us.
Let's take a look at a situation that's very common for those who travel with a guide dog.
Oh, what a beautiful dog.
Oh, thanks. He's working right now. So I know it's really tempting to pet him, but it's actually very distracting.
Oh, I'm sorry.
Oh, that's okay. Thanks for understanding. Let's see how this can be handled more effectively.
Hello, my name is Susan. Do you need some assistance today?
Yes, I'm looking for the ophthalmology department, please.
It's through these doors. The door opens to the right, and it's at the end of the corridor.
Okay.
Would you like me to show you the way?
That would be great.
All
I can
right.
just put him in follow.
All right, let's go.
Okay, Cato, follow. It's very tempting to interact with a guide dog. The guide dog is working to guide the visually impaired person safely. Always interact with the person and not the dog. The person will put the dog either in a follow command or elect to take your elbow, depending upon the situation. Let's discuss a few communication barriers when working with patients who are blind or visually impaired. Sometimes individuals believe that it's helpful to speak in a loud tone of voice when assisting a patient with vision loss. Let's observe an example.
Hello, my name is Susan. I'm going to be starting your exam.
You know, I don't see very well, but I can hear okay.
I know it's surprising, but some folks think that it's better to speak in a loud tone of voice when assisting an individual who's blind or visually impaired. Please speak in a normal tone of voice. If the individual does indeed have hearing loss, he or she will let you know.
Hello, my name is Susan. I'm going to be starting your exam today.
Well, it's nice to meet you.
It's a pleasure.
Another common communication barrier is when individuals direct their questions or speak to a companion rather than to the person who's blind or visually impaired. Let's take a look at an example of this.
Hi, how can I help you today?
Hi, I need an appointment, please, for about 3 months from now.
Okay, now what day and time is going to work best for her? Alice?
Sure. Yeah, Mondays actually are best for me.
Okay, we have an appointment on Monday the 28th at 9:30. Will that be okay?
Yeah,
Okay,
that will
great.
work fine.
Okay, super. We have you down for there. And we'll need her to sign a form before next time. So could you go ahead and sign that for her, please?
You know what? I can actually sign the form for myself. Can you? Yeah.
There you go.
Do you want to show me where to sign? Sure. Again, you'll find it surprising as to how frequently individuals speak to the companion rather than to the person who's blind or visually impaired. Individuals who are blind or visually impaired are perfectly capable of taking care of their own business, and it's diminishing to speak around them rather than directly to them. So please, direct your communication to the individual and not to the companion.
Hi, how may I help you today?
Oh, hi. I actually need an appointment, please, for about 3 months from now.
Okay, what day and time works best for you?
Oh, Mondays. Mondays are best.
Okay, morning, afternoon?
Morning.
Okay, I have available the 28th at 9:30 in the morning. Would that work for you?
Sure, that's great.
Okay, super. And what I'm going to need to do is have you sign some forms today
Okay.
before you come back next time. So I'm going to put the form in front of you on the desk.
Okay.
Here's the pen.
Okay,
And
great.
I'm going to show you where the signature line is,
Okay,
which is right here.
great. And
And
just
then
straight across?
Straight across.
Okay, got it.
Terrific.
Okay. Thank
Perfect.
you.
We will see you on the 28th.
Okay,
Great.
Thanks very much.
Bye now.
Here are some additional tips for working effectively with patients who are blind or visually impaired. Always provide verbal cues. For example, introduce yourself and explain your role. Before beginning a procedure, explain to the patient what you are going to do. Visually impaired patients may not see you approaching, and this avoids startling the patient. Provide an orientation to the room and explain what it is that's available to the patient. For example, clearly explain where the chair is, or if there's a device for them to notify you, explain where the device is and how to use it. And lastly, always let the patient know before you exit the room. Applying these strategies and communication skills will help your patients who are blind or visually impaired to feel more comfortable with the treatment they receive. And you, as a healthcare professional, will also feel more comfortable in assisting a patient with significant vision loss. In addition, it is also helpful to refer a patient with vision loss to an agency for the blind and visually impaired. Partnering with agencies helps the patient to maintain a high quality of life. And we are here to support them and you. If you know someone with a visual impairment who is interested in learning more about our services, please have them contact VISTA Center in Palo Alto at 650-858-0202 or in Santa Cruz at 831-458-9766. You can also visit us on the web at www.vistacenter.org. This video was produced with the help of a grant provided by Cisco Systems Incorporated.